All right, now, today we are celebrating the International Day Against Drug Abuse and Illicit Trafficking. It's a day set aside by the United Nations to strengthen global action and cooperation in achieving a drug-free world. In Nigeria, the National Drug Law Enforcement Agency, NDLEA, is using the occasion to raise awareness about the dangers of drug abuse, especially among young people. This year's theme, The Evidence is Clear, Invest in Prevention, highlights the urgent need to scale up drug education, early intervention and rehabilitation efforts. Stakeholders across health, education and security sectors are calling for more investment in community-based solutions, job creation and mental health services. They say drug abuse is not just a health crisis, it's a social one with deep implications for public safety and national development. Let's talk some more about this. Director of Donor Relations, Initiative for Relief from Hard Drugs and Addiction, Everlasting Hope, joins me virtually. Good to have you join us. What is exactly, would we say, is responsible for the continued rise in production and use of illicit substances, especially among young people?
All right. The statistics state is clear. Because I am currently at the State House where the NDLEA is running this convention, and the CEO of NDLEA, in the person of Buba Mawa, General Retired, stated that over 15 million Nigerians now abuse drugs. If you recall, years back, we always hear how drugs are being peddled outside Nigeria. Now the reverse is the case. We are now consuming these drugs. The first issue that has come to this level is that it has become a global issue. Access to internet, access to Google, everyone is searching for something. At the end of the day, we are now in a globalized environment where what happens in the US is equally happening in Nigeria. The case has become so alarming that it states that out of 5 youths, aged between 15 to 35 are abusing drugs.
It's an alarming
difference between.
Yes, Mr.
Right.
Hope, it's actually an alarming statistic, and just as you've said, it does appear that technology, which is a blessing, is in some way now looking like a curse. But we really do need to move on, and this year focus is on prevention. Just how significant do you think that will be in our efforts to curb the menace?
Yes, prevention is key, because if you go to the streets, not just prevention, we want recovery for all. Like Buba Mawa said, we have about 30 rehabilitation centers in Nigeria, which is not enough. If you contrast it with countries like the US, they have about 18,000 rehabilitation centers. So you can see the level of rehabilitation taking place in these countries. But we in Nigeria, especially for an NGO like us, we are beaming up or teaming up with the NDLEA, Ministry of Health, and other stakeholders to see how we can set up more rehabilitation centers. We have tried in our own very own way to see how we can curb the minutes. We have been going to shanty areas, bringing children out of it. For instance, the cost of rehabilitating one addict is amounting to about ₦1 million. So you can see the gap. Number two, the replacement therapy, which we call methadone, is being imported into this country. And to get that treatment will be amounting, down to detoxification, will be amounting to about 1 million. So we want all stakeholders, we want well-meaning Nigerians to, first of all, because it starts from the family, Once you neglect your children, you have given the society a problem. So we are calling on well-meaning Nigerians to come to our aid. We call on the UNODC, as they have always been doing well, to see how we can mop up more rehabilitation centers so that we can really prevent.
But it's also, yes, but it's also important, to actually look for tailor-made solutions. I mean, solutions that are ingenious to Nigeria, that can actually put into consideration our peculiar challenges to be able to address it. So what do you think individuals, organizations, and government at the local and state level could do at this time to help this fight?
Thank you very much. That's a very, very succinct question. First of all, the idea of drugs and rehabilitation is on the concurrent list. So it means, therefore, that building of rehabilitation centers is not limited only to the federal government. Our own local government, state government, churches, religious homes, religious houses should come into being, even down to families, to see how we can stem the tide. If more advocacy is being done, like what we do at the Initiative for Relief from Hard Drugs and Addiction, where we go to various homes, we do workshops and advocacy. Once we continue to drum up more of this noise, we will be able to get to this youth, and we can see how we can at least bring them out of this scourge.
All right, then. Director of Donor Relations, Initiative for Relief from Hard Drugs and Addiction, Everlasting Hope. Thank you for talking to us on TVC News at 1.
Thank you. Thank you very much.
And talking about stemming the tide of drug abuse.